have a student speaker, Elisabeth Sherratt, who will talk about the class themselves and what this past 4 semesters have been like. A little inside vision.
Good afternoon. My name is Elisabeth Sherratt, and it is an honor to be here today. Faculty, staff, family, friends, fellow classmates, and pinners, thank you all for being here tonight to help us celebrate our move into the nursing profession. Thank you for your support over the last 16 months of revolving schedules, studying, and stress. Tonight, we welcome you to our pinning ceremony to signify our progression into nursing. Sitting before you is a new generation of nurses. We are the entry-level Masters of Science in Nursing students, class of 2014 and 2015. Half of us will continue into the Masters of Science in Nursing for Case Management, and half of us into the Masters of Science in Nursing for Family Nurse Practice. We come to you with rich life and diverse professional experiences prior to entering nursing school. We all have a bachelor's degree in another field, and our previous careers range from teachers to real estate agents, automotive restoration mechanics, and researchers. We are a varied group. We are made up of 35 women and 12 men, with ages from Generation X to the millennials. According to Dr. McIntyre, our Myers-Briggs profiles vary more than typical nursing students do. We commute from as far as Antioch, Vacaville, Santa Cruz, and Marin. Some love Macs and others PCs. Yet despite all of our differences, we share the commonality of an interest in people. Some classmates hope to work with babies, others in geriatrics or with adolescents. Some may even have an affinity for certain organs, wishing to work with patients in cardiac or renal clinics. But at the end of the day, we all entered this program with a love for people. Allow me to share with you what has been going on in the last 16 months that we have all gone missing. Semester 1, academically the most packed and busy time in our program, and our first clinical experience in mental health. The first few weeks started slowly, and then bam, we were run over by a bus. The paper test ATI nursing care plan case study patho farm bus. We were warned by Professor Marjorie Hammer that many students would begin to exhibit the signs and symptoms of the diseases we are learning about, especially the mental health disorders. I would not put it past some of the men in the class to convince themselves they were going through menopause, or the women to claim they had prostatitis, or maybe we just sat in class too much that semester. We were introduced to NCLEX style of test questions, where we were told to choose the answer that is most correct, when in reality they were all correct. When we became frustrated enough to go to Dr. Terry Gwynn about it, she would tell us we were reading too much into it. Just don't think about it so much. On to semester 2, our clinical rotation of med-surg. Med-surg clinicals were the first indication that the human anatomy is nothing like the plastic Harvey mannequins in our simulation lab. Therefore, though we thought we were prepared, we were also not prepared, and it was then that our sense of self-accomplishment faltered. When it came time to clinical rotations, we were all eager to be assigned the good patient for the day. Well, family and friends, I can tell you that what we, the nursing students, define as a good patient, and what you would define as a good patient is most definitely not the same. You see, good may mean a patient with hypertension, on several medications, and with festering wounds needing several dressing changes. Good may mean a patient with a rare condition, a complicated case, or a cool anatomical variation. You see, a good patient meant we could practice our newly learned nursing skills and apply the textbook knowledge to real life. Nevertheless, along with the rare conditions and interesting patients came again that anxiety that, despite the 4 layers of contact precautions, we just contaminated ourselves and our nursing careers might be over before it started. Nightly, we would talk each other down. No, I'm sure you did not catch Hep A, Hep B, MRSA, E. coli, and HIV tonight. Well, yeah, that patch of skin looks red, but maybe you should stop rubbing it with the bleach wipes that say not intended for skin. Some of us may have even melted our scrubs from washing them on extra hot clean cycle, or ruined iPhones by trying to wash them with soap and water, but we wanted to make sure we remained healthy enough to keep going. summer semesters, including critical care, labor delivery, and pediatrics. Each class was packed into 5 weeks, and we were now in class Mondays and Fridays, and at the hospital 3 shifts a week. Not only was this fast-paced and intense in the classroom, it was intense in the hospital. 1 week we were by the patients and family's side as they drew their last breath. And the next week we were in labor and delivery witnessing a baby take their first. We ended the semester in pediatrics spending some of our clinical time at pediatric hospice centers, gender identity conferences, DASH diabetes and sports health camp, and youth in medicine. The patients were small and the responsibilities were huge. Semester 4, preceptorship, AKA the sinking ship, and community health rotation. By this semester, we were all burnt toast and felt as if we were barely afloat. We have been fitting in leadership hours, preceptor clinical hours, writing lesson plans, and teaching our communities about health. We've written more papers than the rest of the semesters combined. And in our downtime, we're trying to prep for the NCLEX, our Registered Nurse Board exam. Moreover, amidst the life of academia and more clinical hours, life was happening all around us outside of school. We have celebrated the birth of a baby, mourned the death of parents, cousins, grandparents, and furry friends. We have had child care coordination issues, car thefts, health diagnoses, and breakups. However, despite all of the craziness life has thrown at us, we are still here. For my classmates that have had to endure more than simply the stress of NCLEX-style questions, I commend you for your resilience and strength. I would like to share a poem I find so meaningful for us as nurses. And what is more important than knowledge, asked the mind. Caring and seeing with the heart, answered the soul. Nursing school has allowed us the opportunity to grow in knowledge within our minds, expand our hearts, and search our souls. Nursing has taught us to look at our patients as more than their physical body, their anatomy, or their disease progression. As the poem states, we see our patients with our hearts. We learn this with person-first language. For example, we do not see a cancer patient. We see a patient with cancer, with a disease that does not define them. This is why in nursing, we do not simply have nursing diagnoses that include signs and symptoms, but that include quality of life, mental wellness, the patient's culture, religion, and the extension of our patients' families. Do not get me wrong, the body, the anatomy, the physiology, it's all very important, but it is the holistic view of nursing that recognizes the totality of the human being. Maya Angelou, whose own mother was a nurse, said it best. As a nurse, we have the opportunity to heal the heart, mind, soul, and body of our patients, their families, and ourselves. They may not remember your name, but they will never forget the way you made them feel. And how exactly was it that we as student nurses made people feel? Well, for starters, nervous is the first word that comes to mind. Especially for the patient who sees the large bold letters of nursing student across your badge as you're holding a large 3-inch needle to inject their ventral gluteal, aka their butt cheek. But we have learned to calm their fears, and really, I think we have made people feel safe and cared for. We have been in our healers, caregivers, teachers, shoulders to cry on and hands to hold. We are givers and mourners. Aside from the basic nursing skills of IV starts, insulin injections, and hanging some saline, we have all become nurses in and out of the classroom. Allow me to share just a few highlights from things I've seen of my colleagues. A fellow classmate's car was broken into, his laptop and notes all stolen before going into finals around this time last year. Another classmate organized a donation drive and we all chipped in money to put towards a new computer. Some of the women have cut their hair and donated approximately a combined 60 inches of hair to Locks of Love to be made into wigs for patients with cancer. We have purchased and donated blankets, jackets, toiletries for the homeless and for female offenders and for residents in low-income communities we've worked with this semester in community health. A group of colleagues went to Africa bringing healthcare and supplies to rural villages. I could continue on with examples, but I'll stop there and say I'm honored to have an amazing group of individuals surround me, and I'm excited to know that the future of healthcare is in great hands. In closing, I would like to offer some words of wisdom to my fellow classmates. If as nurses, We choose to use our status and influence to raise our voices on behalf of those who have no voice. We advocate. If as nurses, we choose to identify not only with the powerful, but with the powerless. We inspire. If as nurses, we retain our ability to imagine ourselves into the lives of those without our advantages. We empathize. Then it will not only be our proud families who celebrate us and our work, but the millions of patients, clients, and their families we have helped. Thank you.
Just lovely, Elisabeth. Thank you so much. Well said.